Okay, so our topic for today is the application of therapeutic ultrasound to our patients. Okay, for things to remember before the treatment, we assess for the indications for therapeutic ultrasound first. Okay, so this can either be muscle spasms or muscle tightness. Okay, assess for any contraindications and precautions for ultrasound. Okay, then we prepare the ultrasound machine. Make sure all required equipment are within reach. So aside from the ultrasound machine, you should also prepare for the ultrasound gel, the tissues, the alcohol, and the tongue depressor. Okay. Then test if the machine is working. Okay, so you turn on the machine. Now take a look at the menus and also the check for the ultrasound head. Then prepare the treatment area. Okay, prepare the necessary towels that will be used, the pillows, etc. And then position the patient. Now make sure the patient is comfortable and in proper posture and properly expose and drape the area to be treated. Okay, so this is your machine, the ultrasound machine, the NRF non-use ultrasound. Okay, so bubuksan mo siya using the switch doon sa may bandang likod malapit sa cord. Okay. So we have here, no, when you click the ultrasound therapy button in the screen, you will see now additional menu, no, the clinical protocols, favorites, and the manual operations. For the clinical protocols, nandyan yung nakalista yung mga medical conditions, and then when you click on that, the machine will use the recommended parameters for that specific medical condition. Then for the favorites, nandyan yung dyan naman nasasave yung mga sinave mong parameters when you perform the manual operations. And for the manual operation is when you manually input the parameters for ultrasound. So let's check the clinical protocols. Ito siya. Okay. So for example, you've selected epicondylitis. Now this would be the recommended parameters for epicondylitis. Okay, so this is for the manual operation. Okay. So we have here the frequency, if it's pulse or continuous. Okay. The intensity. This would be the frequency. And would be the duty cycle. Okay. So here, what you're going to do is, yeah. So if I correct myself, this is for the depth of penetration. Okay. This is where you turn on the machine. Ito, you select this when you're choosing what ultrasound head to use. If it's ultrasound head A or ultrasound head B or both. Okay. Here naman is the timer. So once you have set up all of this, okay, if you've chosen the ultrasound head to be used, you click here and then you manually input the time. So the usual time for ultrasound is, or the recommended time is 5 minutes or duration. Then after which you set up the intensity. Okay? Here, no? Tapos it will automatically turn on. No? Once you have set the time and the intensity. Okay? So it's turned on if your kapag yung machine tumutunog. Ibig sabihin hindi in contact yung machine, yung ultrasound head dun sa skin ng patient. Okay? Okay, just to show you how the machine is or how ultrasound is applied. Okay, so apply the ultrasound gel. Make sure the ultrasound gel is enough to cover the area to be treated. Then manually set up the machine. Okay, manually input the parameters on the machine. Okay. Ayan. So after you have input the time o yung duration dun sa machine, okay, once the ultrasound head is in contact with the patient's skin, no, the treatment will start. Okay, ibig sabihin, kapag dumikit na yung ultrasound head dun sa dun sa balat ng patient, no, mawawala yung ilaw, ibig sabihin nag-start na yung treatment nito. Okay? Yeah. So make sure that your rotations or cycles is 2 to 3 cycles per second and in constant contact with the patient's skin. Okay, so if the ultrasound head is no longer in contact with the patient's skin tapos ongoing yung treatment, biglang iilaw yung ultrasound head. Tapos automatically magpo-post yung duration tapos hindi magpo-post din yung treatment nito. Okay? Magko-continue lang siya once you once the ultrasound head is in contact with the patient's skin again. So for example, tapos na yung treatment. Okay? So you perform aftercare. So that's the tongue depressor and the tissue.
Nala ko sa iba playlist ako to eh. Sinisave nila to eh. Oo sir.
Dahil na naman.
Tipid talaga.
Hindi mo pwede tayo, critical mo kasi bakit ito kasi dahil sa ganun? Pero kung pasyente kasi, ang mamaya sa kabalat ko
Okay.
kasi kung
So next would be the glove technique, no? So yung glove technique is usually used, no, for areas that have bony prominences. So in this example, no, we are trying to treat the lateral epicondyle. Okay, so you fill a bag with water, no, a glove with water, and then same lang din when you're about to perform the treatment, lagay mo ng ultrasound head for lubrication. Okay? And again, it should be in constant contact with the glove. Okay? So again, this is called your glove technique. Okay. Now next would be, sorry, this is your Again. Next would be the immersion technique. Okay, so you fill a basin with water. Now make sure the water is lukewarm. Okay. So this is usually performed for patients with carpal tunnel syndrome. So you immerse the limb on the over the under the base underwater, okay, and then you ask the patient to oppose the thumb and the small finger, okay, para mag-open up yung carpal tunnel. And then when you perform the treatment now, no, make sure that only the head is immersed in water. For example, tapos na rin yung treatment nito. Okay. So in this case, okay, the patient supposedly be in a seated position, tapos yung level ng basin is on the lap of the patient para hindi niya kailangang i-flex yung kanyang wrist. Okay, so again, we perform aftercare and using a towel. So this is a little bit messy as well.
Mang tip yan na nakaraan, kasama yung kapatid niya.
Okay. Yan. So things to remember after treatment, no, ask or assess for patient's response and or feedback regarding the treatment. Perform aftercare, so remove the gel with a tongue depressor and tissues, dispose the medical waste materials, disinfect the patient's skin and the ultrasound head with alcohol as well. Return the equipment into its storage. Then proceed to the next treatment or properly conclude the session. Okay, so that is all. Thank you.